Dear friends, greetings from Mexico. My name is Dr. Alberto Zeus Reyna González. For those who do not know me, I am a dentist with little over 30 years of clinical experience in private practice. I want to introduce a novel system that I developed and recently patented for the aesthetic but economical rehabilitation of infant teeth. I will avoid speaking with technicalities, and I will not use clinical photographs that could bother someone. I will only use acrylic models such as this one to give my explanation. Before starting into the subject of my invention, I would like to make a brief explanation about the importance of infant teeth and the dental health problems that concern you. Unfortunately, tooth decay comes to cause serious damage to children's teeth from an early age. It attacks children all over the world equally, practically without distinction of ethnic groups or social classes. We know that this terrible disease is caused by the lack of dental hygiene that is given to babies and by the excessive use of bottles, which keep the carbohydrates of milk for many hours in the child's oral environments. In this acrylic model, we can observe a typical pattern of cavities caused by the bottle. As you can see, the front teeth are those that are most affected by this type of tooth decay, and this is because they are the first to come out. From the end of the 1940s to the present, the most practical, effective, and economical way to treat this type of tooth decay throughout the world is through the use of these metal caps or corners, which, although they are quite ugly, serve us to completely cover the healthy remnant of the tooth after all cavities have been removed. With these metal crowns, their shape is reconstructed and they function during the useful period of the infant teeth. Subsequently, from the age of 6, the change of dentation will begin and the crowns will be replaced by the permanent teeth. But as you can appreciate, these crowns that have spoiled the children's smile for more than 70 years are already an unacceptable aberration in our times. In recent years, these zirconia-shaped crowns appeared on the market. Although they are much more aesthetic than metallic crowns, they have the disadvantage of being extremely expensive and out of the economic reach of the general population. So if a little boy has the fortune of being born into a well-off family, he will have the aesthetic crown of zirconia. But if this tiny one is born in a family of scarce economic resources, they will have the metal corners. The ZR system that I have developed and recently patented offers us a third alternative. It is another type of crown, as aesthetic as zirconia crowns, but at lower cost than metal crowns. The crowns of the ZR system are made of resin. This is the material that dentists use daily for the aesthetic restoration of permanent or pediatric teeth. Its resistance to the load of chewing and its durability are well established. Another great competitive advantage of the ZR system is that the particular dentist or the dental health clinic will no longer have to invest large sums of money in acquisition of cases with a variety of prefabricated crowns of all sizes for each of the teeth. With the ZR system, the dentist can choose the color and size of the crown and process it in the moment, and thus at much lower cost than a metal crown. Let me introduce the ZR system prototype. The ZR system consists of 3 elements that complement each other for the preparation of aesthetic pediatric crowns at low cost. First, I will show you the positive mold, or against the capsule. It is an attachment made of white silicone, the upper part of which shows the last that will shape the internal cavity of the crown. Now I will show you the negative mold or polymerization photocapsule. It is an attachment made of transparent silicone, included in a glass capsule. Inside the mold, a negative is formed that will give the anatomical shape to the crown. Finally, I will show you this device or polymerization camera whose function is to solidify the resin of the aesthetic ground that you want to process using a high-intensity internal light system. Now I will show you how the dentist can elaborate his own aesthetic pediatric crowns to the measurement and color of your choice in less than 2 minutes and at very low cost. First, we load the negative mold of the polymerization photo capsule with a dental resin of fluid consistency. Now we assemble the contra capsule with the polymerization photo capsule. Notice how to penetrate the mold inside the negative mold. The fluid resin is dispersed, adapting to the walls of the molds to acquire the anatomical shape of the crown to be processed. Now we turn on the polymerization photo camera and place the assembled molds through the hatch of the device. Inside the device, there is a high-intensity light system that surrounds the capsule of polymerization photo. This enveloping light penetrates through the transparency of the polymerization photo capsule, illuminating from all angles the resin that has been pressed inside the molds. The intense blue light activates chemical mediators characteristic of the resin that make it solidify structurally in a few seconds. This process of solidification of the resin by light effect is called photopolymerization. At the end of the process, we simply remove the molds from the photopolymerization chamber, we turn off the system, and separate the polymerization photo capsule from its counter capsule. Observe how the resin crown has solidified structurally with the anatomical shape of a central infant incisor and has been inserted into the last of the capsule. Now I just remove the aesthetic pediatric crown from the contra capsule, and after trimming the surplus, it is ready to be placed on the patient. It's that simple. That's how fast and economical it is. That's how any pediatric dentist can make your own aesthetic crowns when you need them. In the clinical phase, the cementing technique of the resin crowns made with the ZR system is very similar to that of zirconia crowns. Any dentistry student will be able to execute it without problem, and for a dentist with experience, the technique will be extremely simple. First, the cavity is completely eliminated and the stump is prepared in a conventional way. We proceed to test our crown, and if necessary, we cut the surplus required to adjust its height and verify that it is loose in the stump. Next, we apply the recording agent. Then we wash and dry. We apply the bonding agent, and the photo polymerizes as any resin restoration. Now we proceed to fill the inside of our crown with a resin of regular consistency. We pack it with a ball condenser so that it is well adhered to the internal surface of the crown. We place the crown on the stump and cement it slowly, leaving the surplus resin to drain. With the IPC instrument, we remove the surplus. We apply the light of the polymerization photo lamp to solidify the cementing resin. The resin has the property of chemically integrating both the crown and the binding agent with which the stump was covered and solidified by the effect of this intense blue light. The three resin segments are chemically integrated into the same structure that will remain solidly adhered to the stump, completely sealing any possible filtration. Once the crown has been cemented, additional wear could be made with a finish to obtain personalized contours for each patient, or you can add resin increments to increase contours if this is necessary. These are convenient competitive advantages that are impossible to achieve with metal crowns or zirconia. Let's talk about costs and benefits. Here we have the classic stainless steel crown that has been used for 70 years around the world. And here we have the new white crown of zirconia, which due to its high cost is only within reach of well-positioned economic sectors. And here, the resin crown made with the ZR system that I developed and patented recently. To understand the proportional difference of cost that exists between these three types of crowns, I will give you the percentage price that corresponds to each of them. So, if a metal crown were worth 100, then the zirconia crown would be worth 500. And the resin aesthetic crown made with the ZR system would have a cost in material between 30 and 50, depending on the size. All this is very important because this great competitive advantage directly impacts the utility for the clinician and at a much more accessible cost for the patient. With the ZR system, aesthetic pediatric dentistry can be available to all sectors. The same can be used in private offices as in public health clinics, both in the first world and in developing countries. For the moment, this should be the present.
This should already be the past.
And this will be the future. Thank you.